Check, 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 check.
Check, check, hey, hey, check, check. Check, hey, hey, check, check, check.
Hello, hello, check. Yes. Yeah. Good morning to everyone. A very warm welcome to all the dignitaries, delegates, jury members, as well as the quiz participants. Warm greetings from Fever Foundation of India in the background of the grand finale, which is happening at the 7th Annual National Conference of Fever Foundation. And also, uh, greetings to all the people, all the PG students, and the faculties and the doctors who are joining in through our online platform. This is our live streamed across 10 different satellite centers, medical colleges, and through our online platforms, which are being streamed, as well as the YouTube channels of Fever Foundation is being streamed. To start with, a brief introduction of Fever Foundation, the activities, what we do. I'll just take 2 minutes of the time with the permission of the quiz masters and the jury. Can I have the slides, please? Sharif? Yeah. Fever Foundation is an independent body which takes care of all the activities related to fever. It's an independent non-commercial foundation supporting the educational academic activities to address the unmet needs in fever management. The foundation is committed to conceive, build, and sustain programs and make scientific initiatives aimed at providing evidence-based updates to all the clinicians related to fever management. Next slide, please. So the vision of us is to strive towards imparting knowledge on the unmet needs of and provide information on research, education, and therapy updates in fever management. We have various gamut of activities. One in as such activity is the annual National Fever Conference, which happens. Along with it, we also have the fever CMEs. We come out with books. We also have started with the epidemiological research. We have PG specific activities including the quiz competition, poster competitions, young scholar awards, as well as the paramedic patient education and the parent education activities. Today's the quiz we conducted as all of you are aware of it, the Fever Foundation conducted the zonal level quiz across India, which happened huge success this time around. We had more than 1,600 PGs participating in our zonal quiz, and we have shortlisted or the two winners from each of the zone, and we are happy to host all of you here in the Fefcon 7th Annual National Conference. The jury for the quiz today, we have Dr. Next slide, please. Yeah, Dr. M.K. Sudarshan sir is the ex-director of KIMS professor and also former chairman Karnataka government of COVID task force, as well as the member of the WHO expert committee. Also, we have the special jury in the pediatrics hall today. We have Dr. Isaac Moses sir. Sir doesn't require any introduction. He's been the former dean, also the HOD and the medicine at the Stanley Medical College, and also he has in various capacities held the national and international posts. So welcome, sir, for being the jury today. And we have the the teacher of teachers, Dr. Sukumaran, sir. Thank you, sir. Thank you for joining us as the jury today. And he's been the past president of the Indian Association of Pediatrics as well. Thank you, sir. We also have Dr. Ananda Kesavan, sir. I think most of you might have seen him very familiar in our poster competitions and the previous quiz as well. Thank you, sir. Thanks for being here with us and being the guiding force in conducting various student-related activities of your foundation. Thank you, sir. Also, we have Dr. Anand Vasudev, sir, from Delhi joining in today. Sir has been instrumental in conducting various workshop activities for us and also preparing the charting out the agendas on various scientific events. Thank you, sir. Thanks for joining in. And Yagnesh Popat, sir, as always, is there for us for every activity and is also being the, what do you call, the man behind all our difficulties. Wherever we have, we always stop at him and he has been the guiding force for various activities of your foundation. Thank you, sir. Thanks for joining in. And we have the quiz masters today. Next slide, please. We have Rasna madam. I think all of you does not require introduction. Last 7 years, she's been the quiz master and conducting the quiz. And madam is the professor and superintendent at the Postgraduate Institute of Medical Sciences from Meghalaya. And also she has various posts held at IAP and she's been an ardent speaker at various national and international conferences. Thank you, ma'am. Thanks for accepting the invite and successfully helping us. And this is the 7th year we are conducting in row the quiz. And I think this is the first time we are having the grand finale in physical round. I think thanks for all the advisory board members and the jury and the quiz masters for helping us to host this event. And we also have special invitees and the quiz masters. We have Dr. Vishwanath Kamoji, sir. Sir is the lead pediatric and neonatal consultant at Spurs Hospital, Bangalore, and also as well as been there at Columbia Ishwa and Manipal hospitals. Thank you, sir. Thanks for accepting our invite and thanks for being the quiz master today. Also, we have Dr. Balivan, sir. Last 2-3 years is there with us, helping us on various activities of Fever Foundation, helping us instrumental in preparing the modules or the quiz as well. Thank you, sir. Thanks for joining in. So, I'll just take about the rules and regulations of the quiz. So these are the basic rules where the quiz, this is only for the postgraduate students. The quiz consists of multiple choice questions and there are a few rounds where there are open-ended questions as well. Each round will have a time limit for answering questions. No, at any given point, you cannot be using any of your mobile phones or any other electronic devices other than what is being given by the jury members or the organizing committee. Once the answer is submitted, it's not possible to revert, and at found any type of foul play, automatically the candidature will get disqualified. You cannot be seeking questions or answers from your colleagues or from people sitting nearby or any of the audience. These are the general rules which I want to make it clear again. PO Foundation will not be responsible for any of the technical form of error, and participation of the quiz implies that participants will accept all the integrity of the rules. Non-compliance with the rules will result in automatic cancellation, and whatever the decision taken from the quiz masters and the jury will be final. So how do we go about the rounds? Today we have 4 different rounds. The first round is the general round with multiple choice questions. The round 2 will be the case based round. Round 3 will be the image round, and the round 4 is the buzzer round. I'll just explain in brief every round. We can have the next slide, please. The round 1 will have direct questions with 4 multiple choice options. It will be passed on, it will be a direct question to each candidate, and there will be no passing. Whoever answers right will get 10 marks. And the timeline is the entire duration, in the entire quiz format, it's 15 seconds. And there is no negative marking in this round. Round 2, 1 question will be asked to each candidate. If that candidate answers right, he will get 10 marks. If that candidate is not answering, it will be passed to the next candidate. So this is a passing round, but it will be passed only to one person or the one person sitting next. That's it. The passing will happen to only one person. If the person answers right, he will get 5 marks. Round 3, a question will be asked. This is an image based round. During this, a tab is kept on all of your tables. The questions will be displayed on the screen as well as the tab. When the question is asked, all of you are supposed to answer in the tab except for the person who is answering. When the question is directed to, for example, if it's directed to person A, then the person A should answer within 15 seconds. In the meanwhile, the other B, C, D, and E other candidates should answer in the tab. The time limit is 15 seconds. When the question is being asked to that person, all of you will answer simultaneously. In the process, if that person does not answer right, then whoever has answered right will get 5 marks. All the people who are answering simultaneously when that person has not answered will get 5 additional bonus marks. Clear, all of you? Next round, this is the buzzer round, where the fastest finger, the buzzers are kept on off your tables. You need to press the buzzer, then the quiz master will ask to answer the answer. This buzzer is such a way that whosoever presses first, the light glows and the other buzzers will get deactivated. No matter if you press also, it will not get deactivated. Yeah, and the answering is, if there's a typo error here, it will be 5 marks for each of the right answers. Okay. And the last will be the tiebreaker round. If we get into the tiebreaker, again there will be the buzzer round. So these are the rules and regulations of the quiz. So what we have done is, with the permission of the jury members, what I'll do is, next slide please. Yeah. To introduce, with the permission of the jury, I'll like to call upon all the people present here. We have Dr. Sonu Prajapat, Dr. Revant, Dr. Vijaya, Dr. Nili Mehta, Dr. Chinmay Jaina, Dr. Vivek, Dr. Shankar, and Dr. Vidyashree. These are the 8 people who got qualified for the finals. Unfortunately, we don't have 3 of them for joining us today. We have 5 people joining in. We have Dr. Sonu is here. Yeah, Dr. Sonu, please onto the desk. Just be here. So what the seating position, again, with the permission of the jury, there will be a chit based which they need to pick it out. So next is Dr. Vijaya. Dr. Revant, I think for some reason, personal reasons, is not able to join us today. Dr. Chinmay Jaina. Dr. Shankar. And Dr. Vidyashree. I'd like to request Dr. Isaac Moses sir on the desk, please, to take out the chits. I think it's time for me to hand over the sessions to our quiz masters, Dr. Rashna ma'am, Dr. Balivan sir, and Dr. Vishwanath sir. It's over to you. Thank you. Yeah, I request all the participants to introduce yourself so that we can write down your names in the back end as well.
My name is Dr. Sonu Prajapat. I am from Dr. SN Medical College, Jodhpur, Rajasthan. Thank you.
Myself, Dr. Chinmay Jana from Kaling Institute of Medical Sciences, Bhubaneswar, Odisha.
Myself, Dr. Vijay Ruge. I am first year pediatric resident at IGGMC, Nagpur.
I am Dr. Vidyashree Gundala. I am from Kakatiya Medical College, Warangal.
Myself, Dr. Shankar Dodmani from Karnataka Institute of Medical Sciences, Hubli.
So, very good morning. You are representing different parts of the country. Now you already winners. So already you are winners of your region, and also we can select only one as a first. So don't mind it. So you are all winners of your zones and whatever is your college, then your zones, whatever it is, and all the best for all of you.
Dear friends, let me at the outset congratulate all our postgraduate students who has come forward for this quiz program, and I wish them all the best. Thank you. Yes.
Disadvantage of being short. I'll have to come this side because I can't see this. I can't see this also. So, good morning to all our respected senior members of the jury and my colleagues, our quiz masters, and of course the participants. So, what we'll do is we'll start first with some dummy questions so that you get used to it. And the tabs, have you seen if they're on and on? Because we'll be using that for one of the rounds. Okay, they're all on without password. So, can I ask Uma to display the first question? Okay, so this is on Bangalore city. Our own Bangalore is called the Blue City of India, Silicon Valley, Traffic Jam City, and Lake City of India. This is not for the quiz participants, it's for the audience. So we give you, your time starts now, 15 seconds. All of the above. But that choice is not there, Nazar. Will come. Okay? So at the end of 15 seconds, we will display the answer. So can I have who wants to say Traffic Jam City, Agnesh Popatji? Anybody else? Silicon Valley City. I think both are not correct. Can you display the correct answer? It's, I think, Lake City. Acha, oh. So we have to give special prize to Vasudev sir. Okay, then we have one more question. So just practice. Huh? Mysura is famous for Mysore silk, Mysura Deshera, all of the above? Okay, so this is how it will go, okay? Within 15 seconds, you have to give. Okay? So all of the above? Yeah, so correct. Everybody gets a prize. So we'll go to the main quiz now. So we'll start with A, which is Dr. Sonu. So can we have the first round questions? So fever in children under 3 months should be considered normal, low risk, high risk, or self-limiting. Your time starts now. High risk. Okay, so his answer is high risk and he has answered within 15 seconds. So can we display the answer? So high risk. Very good. Congratulations. So he gets full marks for question 1. So before you would like to, Uma, you would like to display the answers also, na? Okay, okay. So this is the reference from where we have taken this particular high risk definition of fever for below 3 months. Any of the juries would like to add anything, sir? Sukumaran, sir.
Yes, as you all know, fever is a very dangerous sign in children less than 3 months. Especially fever without localization should be considered very seriously. And in the management also, all these babies should be admitted in the hospital. We must have an inpatient management for these children, and these children should be investigated. Initial investigation include ACBC, ESR, CRP, urine microscopy, urine culture, and that persistent fever is there. We must do 3 punctures, either a urine culture, CSF culture, and blood culture. Should be taken very seriously, and you should start antibiotic depending on the condition of the child. Thank you.
Another point is that in newborn, even though there's infection, the child may present with hypothermia and fever should not be there. So we have to always keep in any child, because fever may not be a marker in the newborn. You may get, instead of getting fever, you may get a hypothermia also.
Yeah, so very good point. So below 3 months of age, all are to be considered as high risk and admitted and given antibiotics. So you can't send these patients off. And what Anand sir has said that those in the newborn period may not have fever. They may have even hypothermia as a presentation. So thank you very much. We will go to the next question, which is to Dr. Chinmay Jaina. So can we have the next question being displayed? Which of the following is a major criterion in the diagnosis of in the revised Jones criteria for diagnosing?
Polymixing was the correct answer. That means these are the very resistant bacteria, and this was in news 4 or 5 years back when they said that all antibiotics are failing in these types of resistant bacteria, and only thing which is effective is polymixin, which comes as a colistin. So they are even resistant to carbapenem antibiotic like ertapenem, meropenem, and nothing is working on them. Although they have tested this thing in more of a sewage treatment plant where they check that what type of bacteria are there. And other antibiotic which are effective is TG-cycline. So these 2 antibiotics are effective in this. So I think Computerji has put this time very tough question compared to your zonal quiz, and we are still to see a person who scores above at least 5 or 10 marks. Okay, and very disheartened to see still very difficult question. But all is from Computerji. I haven't done nothing. All MCQs are given by Computerji, and I've changed nothing at all, really. We'll start with the question number 4 for contestant number D. He is Muhammad Akram. Yeah? Computerji, can we have the question? He is from Stanley Hospital, Tamil Nadu. Which of the following organisms caused by the disease dubbed as Vietnamese time bomb? A lot of international question is there. Is it Burkholderia pseudomyeli? Is it Actinomyces israeli? Is it Aspergillus medulente? Or is it Candida tropicalis? Your time starts now. It's another rare disease with the international options. So one of them causes Vietnamese time bomb. Option A is Burkholderia pseudomyeli. Okay, good. So here's option A, and I think Computerji, can you have the correct answer? Great. So he has opened the account, and very well said. Have you recently read about that, which is a rare disease for India? It causes melioidosis disease, and it is seen during Vietnam War that American soldiers who were fighting there, when they went back, even after 1 year, they developed this fever and a lot of systemic symptoms. So it's like a time bomb that was fixed in Vietnam. When they went back, they developed this disease, and nowadays a few cases are reported from India also. So the treatment is can be given only when you suspect this type of infection. So melioidosis is the disease, and very correctly said by Dr. Akram, and congratulations. So he got 10 marks. So team D has scored 10 marks. Stanley. We'll go to question number 5 for person number E. He is Dr. Shreyans Goel. He's from Akash Institute, Delhi. Again, okay, one more from Delhi. Two persons are coming. Computer, you can have the question number 5 for participant number E. Okay, your question is, which of the following is a potential long-term complication of measles that can occur years after infection? So after years, that may present as a complication. Is it myocarditis? It is encephalitis? Is it subacute sclerosing panencephalitis, or is it asthma? Your time starts now. One of the option is there. Option C. Option C, and he's taken less than, I think, 2 minutes, 2 seconds or 4 seconds. So, computer ji, can you have the correct answer? 2. Yeah, correctly. It's a SSPE, which is a very debilitating disease, and it's correctly answered. And I think it was. You have seen any patient with SSPE in your practice? Not even in college. You are from Akas Super Specialty. We don't expect in that hospital at least. So these patients present after 10 to 15 years of measles, when they develop measles, but not everyone. There is some immune irregulation in this, and but very debilitating. The child suddenly, who is doing good development all over here, suddenly becomes incapacitated. He's not able to speak. He's not able to walk and all. So a lot of mental disability comes, and diagnosis is by suspicion, EEG, and you can have anti-measles antibodies are there, and EEG may also help you. And myoclonus, and most of the patient doesn't survive. So SSPE is the correct answer, and any of us neurologists want to have some words? I think they are still to come. Okay, so we have 2 participants who has opened their account. We will go to question number 6 for participant number F, who is Dr. Niranjan. He is from Rima Ranchi, Jharkhand. Computer ji, can we have the next question for participant number F? Okay, it's another international question. This quiz is being very international. Yellow fever vaccine is a dash. Is it a killed virus vaccine? Is it live attenuated vaccine developed by pasteurization passage? Or is it live attenuated vaccine produced by direct mutation of the virus genome? Or is it experimental vaccine only, not using clinical practice? Your time starts now. You can take 15 seconds just to think. Option C. Option C is a live attenuated vaccine produced by direct mutation of the virus genome. I think a lot of international faculties are here. Dr. James Panda must have traveled a lot to US and all. Sir, have you been taken the vaccine in yellow virus? Yes. You have taken?
South Africa, anybody traveling to Africa to take, and unfortunately don't have in our country, but African travel in cost for the vaccine.
Africa and even US, and recently it was in news that vaccine has, we don't have that much of vaccine, and people were not able to go outside India or travel because they were not getting the vaccine. So do you think he has correctly answered, sir? Which vaccine you got? That's some, but Indians will take you back, sir. So which vaccine did you took, sir? He said C you took. C. Okay, let's see what Prabhuji tells us. Can you have the correct answer? It's B vaccine, sir. It was a very old vaccine. It's very, very old. I think it's a 2020 or a 17 year vaccine. They are just taking another reproduction, or you say new cycle. So they are not mutating this thing. Oh, yeah. So it's 1927. This strain is developed in 1927. It is still going on. They have slightly, because of repeated this strain development, that 17D has become 17DD or 17DF. It's an old vaccine developed by Pasteur technique, nothing new. But you all need that vaccine when you go outside. So if you go for MLE and all, you will need that vaccine. That's why this question was put by Prabhuji, and but you lose 5 marks, sorry. So okay, so you have second round to come up. We have penultimate question for participant number G, and she is Sheetal, and she is from ESIC Karnataka. Okay, computer ji, can we have the next question for Sheetal? Is a trench fever is caused by dash? Is it Borrelia recurrentis? Is it Bartonella quintana? Is it Borrelia burgdorferi or is it Bartonella bacilliformis? Your time starts now. All questions are very international, very old, World War I disease, and still going on. Option B. This is given now option B, Bartonella quintana. How sure it is B? Have you read about it? Bartonella quintana is called some other name also. I think Rho quintana we get things, Rho and sometimes Rickettsia quintana also. So that means you are correct. Computer, can you have the answer also? Okay, so she has a correct answer, correctly answered because rest of them look slightly out of the way. So it's a Bartonella quintana, and this is disease also found in World War I only. During that, soldiers were living in trench and all. So this is more of a louse borne, a lot of pig borne, because it's a fever base. So we are more keen on taking fever, why this fever is coming. These are the causes of recurrent fever, PUO cases. So here, trench fever is due to louse or lice which stays in body of humans, and they can have this Bartonella quintana, or also called Rho quintana, that can cause a fever and a PUO. Very correctly said, and very good. We have one more participant with a score of 10, and this is the last question for participant number H, and he is Dr. Mayank, and he is from Rajendra Institute, Medical Sciences, Jharkhand. Okay, Computer Prabhuji, can we have the last question for Jharkhand team? It's question number 8. Which of the following is the commonest cause of bacterial meningitis? Is it immunocompromised individual? Sorry, immunocompromised individual. What are the infection which is very commonly caused bacterial meningitis? Is it H. influenza? Is it L. monocytogenes? Is it S. aureus? Or is it S. pneumoniae? In immunocompromised patient. Your time starts now. Option B. Option B. What is L stands for? Listeria. Okay, computer, you can hear the correct answer. Very well. Listeria causes a lot of immunocompromised infection, especially meningitis as well as pneumonia. And what is the antibiotic of choice for listeria and bacterial meningitis? Ampicillin. Very good. What is the dose? I think it's 2 gram 4 hourly. 2 gram 4 hourly is a big dose. 4 hourly means you do 6 times at least. So 6 to the 4, 12. So 12 grams? So it's a high dose, not a simple dose, 1 gram and all. So very correctly said. So whenever you have an immunocompromised patient, like you have a HIV patient, you have an alcoholic, you have very elderly with meningitis, whatever antibiotic you give for strep pneumonia, you should cover it for listeria also. So Computer and team fever team will give 10 marks for this answer. And this way we have completed the round 1. And Prabhuji, can we have the scoring on the screen? Yeah, so round 1, team D, E, G, H has already opened their account, while team A, B, C and F still to do better in round 2, which will be taken by Dr. Ramesh. We can have an audience question. We have chocolates for here for audience. We will put one question for audience. Computer, can you have the question number 9? Just one question. Okay, donut lesion, I hope we have chocolates. So the question is, donut lesions are seen in, is it streptococcal pharyngitis, is it bullous impetigo? This is not for a participant, this is for audience. Staphylococcus scaldal skin syndrome or infectious mononucleosis. Your time starts now. Anyone want to answer and take a chocolate? Just raise their hand. Your time starts now. Computer, time start कर दीजिए. Anyone, even first, second row. Time, computer, time. I think computer doesn't want to start time and start with round 2. I think nobody has raised hand, so we'll save our chocolate for second round and third round. Okay, we'll save the chocolate for round up to round 4, but we can have the answer, Computer ji. Streptococcal pharyngitis, and we have a slide for this. Next slide, please. Next. So these are the donut lesions you can see in group is streptococcal infection, and these are the donut lesion, round lesion with a pale inside. And thank you. We ask Dr. Ramesh to continue with second round. Sir, any? Yeah, that I missed, sir. I didn't know computers is going to put this as a question number 9. I thought it will come in round later on 3 and 4. But we will keep donuts also. Dr. Manjula, we'll need donuts also now. Dr. Ramesh will take the round 2. Thank you. It was interesting. Thank you.
Again, very good morning to all of you, the participants, Fefcon, organizers, Dr. Manjula in particular, and the jury which is in front of me. Participants, this round is a different round what we have been doing on the online quiz for the previous years. So you see, this round will have the opportunity for all of you who haven't scored to gain more marks, and the participants who already have scored to double their marks. So this is something which is very unique, which we have introduced this year, thanks to the organizers. So to begin with, let us familiarize with the rules of this round. And if we have, do we have, yes, so we have the slide for this round. So it says that one question will be asked to each candidate, and the marks allotted for that question will be 10 marks. Time to answer will be like 15 seconds. And the unique thing is this will have a passing round. So if I have to summarize it, if I ask the question to team A or the candidate A, he will get 15 seconds to answer that question. So meanwhile, the next participant, that is team B, should be clear in his mind that if team A makes it wrong, doesn't answer it correctly, so the question will automatically be passed to the next team, which is team B. And immediately, I will ask if team A answers it incorrectly to answer from team B. So team B has to come up with the answer. There will be no negative marking, but yes, team B will have an opportunity to gain 5 marks if team A answers it incorrectly. Am I clear? Am I clear, all the participants? So, yes, sir. Yeah, so this is only one pass, team A to team B. The second question will be for team B, the pass will be to team C. The pass may not be there if that particular candidate answers it correctly. So, team B will pray, God, don't allow that, you should answer it correctly. No, so, but okay, the things go like this. So, should we go for a dummy round for this? Okay, so we can have a dummy round for this. So let us pray to the Prabhuji and our Guruji who is at the back end. So please help with the dummy question. So dummy question is, which animal is known as the ship of the desert? And this question is for team A. Team A, and the choices here is A is horse, B is camel, C is donkey, and D is zebra. And the time starts now. B.
Give a wrong answer.
So you can answer in the 15 seconds, yes? Your answer anything? Yeah, B. What B? Pardon me, B. So his answer is B. That is camel. Computer ji, can we have the correct answer? So he has answered it correctly and we are not going to pass it. So this is the way in which we are going to proceed. Is it okay? Had it done it wrong, the answer was wrong, so I would have straight away gone to team B for the pass one. Okay, so let us go ahead with the quiz. I think we can go, sir, with your permission.
Yeah.
Yes.
Anybody, any doubt? They are very clear, young, fresh.
Yeah, so we have 8 questions and the passes will depend on how much or how many the team answers it correctly. So let us begin with the round 2, which is, just a minute. So this round is a case-based round and we will give you a clinical scenario. Till I finish my question, the timer will not start, so you will have ample time to read the question, to identify it, use your brain and answer it correctly. So these are all clinical questions and these are all day-to-day what we see in our clinical practice. So with this, let us start round 2. Computer ji, please, we should have round 2 now. Please display the first question. So the first question here is for team A. The question says, it is 45-year-old female. She presented with fever, cough and hemoptysis for the last 10 days. She had a known case of SLE, and recently she received 2 cycles of intravenous rituximab. She also complained of severe headaches, which started about a week back. But there was no history of any abnormal body movements, altered or abnormal behavior, vomiting, blurring of vision, or neck stiffness. There is no history of any tuberculosis or any tuberculous contact in the family. A CT scan was done which showed a right-sided pleural effusion, and there was an underlying area of consolidation. Contrast-enhanced MRI was done which revealed a cerebral abscess. Bronchial washing was also done for this patient which revealed some organism, and the image is shown as in the image below. The patient was started on IV cotrimoxazole therapy, and the patient became symptomatically better. So what is the likely diagnosis? The choice A is aspergillosis, choice B pneumocystis cerevisiae, choice C nocardiosis, and choice D is tuberculosis. And your time starts now, team A. C, nocardiosis. So the team A has answered it as nocardiosis. Computer ji, just wait. Yes. 2, 1. Okay, sir. So the team A has answered is nocardiosis. You want me to answer from? Okay. So do you want to take this question? Although I'm not sure if you get the marks for this or not, but your take for this question. Option C. So he's also going for option C. This is nocardiosis. So both the candidates. Okay. Can you tell me why do you think it's nocardiosis? Any idea about this? It is. Yeah. Just a minute. I think it's not all right. If you're comfortable answering it.
Branching filamentous pattern, acid fast, we can see on the picture shown.
I think candidates have answered it very rightly, and very nice to hear that. Computer, can we have the correct answer first? So the correct answer is nocardiosis. A round of applause for the candidate. So he will be given 10 marks. And we can have a little explanation from the slides which are ahead. Please, the next slide. So nocardiosis is a gram-positive acid-fast branching filamentous atopic bacteria, as he has told, and the risk factor was immunocompromised state. The clue to the question which you could have picked is that the organism responded to the treatment with an antibiotic, which was cotrimoxazole, which is unlikely to be there in other choices, which was there like actinomyces or so. So we can have the next slide. So these are the different patterns which we see in gram staining or an acid-fast staining. Aspergillus is not acid-fast, but the septate hyphae, they are visible. Pneumocystis cerevisiae is as seen in the image, and acid fastness of tuberculosis is seen in the at the raw chair as we see in the Ziehl-Neelsen stain. So full marks to you. So next slide, please. It's the next question or the next slide? So we can go to the next question for team B. Yes, so team B, your question is, a young female presented with unilateral painless swelling of the eye as shown in the image. Which of the following organisms can cause this sign? Choice A, it's Trypanosoma cruzi, B, it's T. brucei, it's C, it's T. gambiense, and D is T. rhodesiense. Yes, your time starts now.
Option A.
So the candidate has opted for choice A, and if we want to have the answer from the team C, Dr. Deepu.
So option C.
Option C. So there is a dichotomy in the answers, but so what do you pray, Dr. Deepu? You
I
want,
think it must be probably A, but I just want to change because.
you want to change your answer?
No, it must be probably A, but I would like to try my luck in case if it is not A, then.
Okay. So you want to keep the speed in both the boards. Okay, so let's have the correct answer, computer ji. So the correct answer is T. Crusoe. So it was, I think, not a very difficult question, but yes, we can have a little clinical explanation for this, that this is known as a Romana sign, where it's a unilateral pinnless edema of the palpebral and the periocular tissues. And it is after this infection with T. cruzoe in the, and also known as Chagas disease. And the full marks to team B, 10 marks to team B. So we can go ahead with the third question to team C. So third question here is to team C. A 30-year-old male has returned from the USA around 2 weeks back. He is currently complaining of high-grade fever associated with chills, myalgias, and headaches. There is no nausea, vomiting, no respiratory distress or meningeal signs. CBC or a hemogram shows anemia and some thrombocytopenia. The tests for malaria and dengue were negative. Peripheral smear findings are shown as in the figure. The likely diagnosis of something X was made and some treatment was started, which was the first-line therapy for this particular condition. And so what do you think should be the treatment for this particular diagnosis, which was X? The choice A here is chloroquine, the choice B is artesunate plus lumefantrine, the choice C is azithromycin plus atovaquone, and the choice D is amoxicillin plus quinidine, and your time starts now.
Sir, option C.
So, Dr. Deepu has opted for choice C, and let us ask the same question to team D.
Option D, sir.
Option B. Okay, so again there is a difference in the opinion. So what do you think, Dr. Deepu? Could this patient be suffering from, or why did
Sir,
you
the
opt for this?
condition is babesiosis.
Okay.
The Maltese cross appearance can be seen.
Okay, and what about team D? Why did you opt for choice D?
Same like in some.
Almost same, but you wanted to have a different in case it, okay. So what is the correct answer, Prabhuji? So Prabhuji is saying it is the same answer as what Dr. Deepu has opted for. It is azithromycin and atovaquone. So the diagnosis here is babesiosis, and you rightly identified the same from the slide. That the presentation remains as for other topical diseases like fever, chills, and sweating with myalgia and hepatosplenomegaly, but the microscopic examination is very characteristic, as it we can see the Maltese cross sign. The closest differential remains the malarias, which we can confuse it with the schizoids, and so if you can identify it and if you know the treatment for those atypical organisms, which is azithromycin along with atovaquone, so that I think for a postgraduate that's sufficient. So full marks, 10 marks to team C, and we can have the next question for team D. So this was the life cycle. So team D, next question please. So the question here is, a young male with history of travel from Nigeria about a week back presented with some fever for the last 5 days along with the new onset vesicular rash on his face and hands, including his palms as shown in the image. There was no significant past medical history, and there was no history of any immunocompromising comorbidities. The patient has some cervical lymphadenopathy, so which of the following is the likely diagnosis? Do you think it is choice A, rickettsial pox, it is choice B, monkeypox, choice C, is it chickenpox, or choice D, it is smallpox, and your time starts now.
Sir, option B.
Just going for monkeypox, choice B. Okay, so, and what about team E? If he's wrong or is right, I don't know.
Option A.
You're going for rickettsial pox. Okay. Any particular reason, team D, you think it is say a monkeypox? Why not chickenpox? Why not other pox?
History of travel to Nigerians.
Pardon me?
History of travel is to Nigerians.
History of?
Travel to Nigeria.
History of travel. Okay. Anything else? Any clue you could pick up in the question? Or why do the team E thinks it's a rickettsial pox?
Actually,
I think also option B is right, but if he's wrong, then
Okay, so let us have a. Everybody is going for this. So this does have to be.
rash pattern, mostly this is seen in monkeypox. In
That rash will be equally seen in chickenpox also.
SR formation or erythematous rash in rickettsia.
Okay, but this is not an SR or that sort of a. Why not chickenpox? I have just shown you that this lesion over the forearm. Okay, so what is the right answer first? Computer ji, Prabhu ji, please have the right answer. So the answer is very correct. The full marks are to the team B, who has opted for monkeypox, the closest differential of all the viruses causing vesicular lesions. The chickenpox generally starts with on the trunk and then it moves to the periphery, centripetal distribution. Monkeypox, of course, is mainly seen on those limbs first, and then they may not be on the pleomorphic stages what we see in the varicella type of diseases. And the cervical lymphadenopathy is one which differentiates generally what we are seeing in India, that the other diseases do not have cervical lymphadenopathy. So that was a clue which was given in the question if you could have picked. And that's also important when we make the guidelines for monkeypox, that look for the cervical lymphadenopathy, probably we should not miss for it. So, okay, full marks to you. So, Computer ji, can we have the next question for team E? So next question for team E is a 21-year-old patient with HIV, and he was on antiretroviral therapy and presented with some itchy hyperkeratotic scaly erythematous lesions on the extremities, which was termed as piled up sand appearance. And he had this for 2 months of duration, and they are shown in the image A. And the patient's nails were thickened and discolored also. The patient was cured after the start of a drug, and that was the image 2 which that the patient has responded to the treatment. And what is the likely diagnosis you think, and what is the name of the drug which could have cured this disease? I think Dr. Ghanshyam must be interested in this particular question. So the choice A is ichthyosis, and the treatment is topical salicylic acid, or it is choice B is ecthyma, or it is that you give oral cefalexin. Choice C is a Norwegian scabies, and you give oral ivermectin. The choice D is some Langerhans cell histiocytosis, and you give steroids, prednisolone. And your time starts now.
Option A, ichthyosis, tropical salicylic acid.
So team E is going for option A, and so team F will have some opinion for this question.
So option C.
So team F is going for the option. So they're totally different options. So Dr. Ghanshyam is arranging for donuts also. Let us see, Dr. Ghanshyam, we may not need it. Let us see. So the question is again clinical based and image based question. Can we have the answer first? So then we can discuss over it. So the answer is C, Norwegian scabies and oral ivermectin. So the scoring for this particular question will be that team E will not get marks for this. Team F will get 5 marks for this. Okay, so congratulations to team F. So why it is not ichthyosis and why it is Norwegian scabies, so that we can understand from the next slide. So Norwegian scabies is, we all know scabies is caused by this vector Sarcoptes scabiei, and particularly immunocompromised state was given in the question itself. And this particular widespread hyperkeratosis and crusted skin lesions are seen. No, just previous slide please. Previous slide please, yes. And the treatment here is permethrin, which is locally applied. So why it is not the other 2 options? Yes, next slide. So ecthyma is a skin infection which is characterized by a crusted source beneath which ulcers form. It's a deep form of impetigo, as the same bacteria causing the infection are involved. And ecthyma causes deeper erosions of the skin into the dermis. It's a bacterial infection. And ichthyosis is a group of disorder which is characterized by scaling. So generally this is the image, and that does not respond to your ivermectin. So clinically some situation was given in the question which by which you could identify that this was an immunocompromised state, the image and the treatment. So you have to use your mind. So why did you opt for this choice C?
So firstly, because of the immunocompromised state of the patient, and ichthyosis, it has a different kind of scaly morphology which was missing in that image.
Okay, so that's how we learn and how we go about these questions. So the next question will be for team F. Prabhuji, can we have the next question? The next question is: a farmer presents with multiple infected wounds on the lower limbs, as shown in the image given below, for the last 3 months. And he had tried with few antibiotics, but the wound did not heal. And he noticed that there was eruption of multiple nodules over the limb. But there was no granular discharge or any frank purulent discharge from those lesions, and there were no systemic complaints. The patient responded to some oral terbinafine therapy. So which of the following is the likely diagnosis? Do you think it is nocardiosis? Do you think it is actinomyces? C, it is porotrichosis. D, it is erythema nodosum. And your time starts now.
So option C is porotrichosis.
So he has taken less than 2 seconds to answer this question. He may be a little confident. Team G, do you have an answer for this?
Option B.
Option B. So you think it's actinomycosis and it is not sporotrichosis. Okay. Why do you think it is this sporotrichosis?
So because of this linear pattern of this lesion, which I've seen previously in some cases.
Okay. Anything else?
Answer the terbinafine therapy patient.
Okay, so that was, I think, and why did you think that is not, okay, so you opted for this. So what is the right answer, computer ji? So the answer is very correct, that you have identified it, and I am happy that you have picked it up rightly, that the clue here given was that it responded to some antifungal rather than an antibacterial, because he had tried over some time over his antibacterial therapies. So clue was that there was no discharge, the patient did not respond to antibiotics, his occupation, and he responded to some antifungal therapy. Next slide. So actinomyces is generally a bacterial infection, so it should not ideally respond to your usual antifungals. So we can have the next question for team G. So team G, a question is: a 50-year-old man with prostatic aortic wall presents with fever and new onset murmur. The gram stain slide is attached. The organism is coagulase negative and catalase positive. What is the best antibiotic regimen for this patient? The choice here is A is it ceftriaxone plus rifampin? Choice B is vancomycin plus gentamicin plus rifampin? Or choice C is daptomycin plus gentamicin? Or choice D is amoxicillin and a clavulanic acid combination? Your choice, your time starts now.
Option C.
So team G is going for the option C, and team H.
Option B.
Team H is going for the option B. Okay. So let us ask first team H, why do you want to go for option B?
It may be coagulase negative Staph aureus.
Okay.
So the vancomycin should be used in.
Okay, and why do you want to go for the choice C?
Scones, but got confused.
Okay, so you're not very sure about the treatment, whether it is B. So closed differentials are something we correctly identified the organism, I think, based on the image and the biochemical reactions which are given. Prabhuji, can we have the answer first? So the answer is vancomycin and gentamicin and rifampicin. So the award for this particular question will be that team H will get 5 marks for this. So sorry that team G will not get. The organism identified is very correct, that it is a Staph epidermidis coagulase negative gram positive cocci, and the treatment for such, the next slide, is for the prostatic wall which was there. It's a disease where the aggressive treatment should be there, otherwise the disease will invariably be fatal, and the treatment recommended is a higher level of antibiotics which should include vancomycin, gentamicin and rifampicin. So very nice. Okay, so next question is final question is for team H. The question here is: a 38-year-old man with HIV with a very low CD4 count of 40 cells presents with headache and blurred vision. CSF analysis revealed a microorganism which was positive for India ink staining as shown in the figure. What should you think is the most appropriate initial treatment? Do you think it is A, fluconazole plus prednisolone? B, is it amphotericin B alone? You think it is C, liposomal amphotericin B plus flucytosine? Or D, it should be voriconazole. So time starts now.
C.
Okay, so before even the timer set, he was ready with the answer. So it is, he is saying that it's team C, and that pass will go to, if at all it is there, it will go to team A. So you can also be ready with your answer, team A. Any team A? You want to go for answer A. So you think A and A will be A square. Okay, so team H is going for choice C. So can we have the correct answer first? So answer is, you are right, the answer is liposomal amphotericin B and flucytosine. So this question will not be passed. The full marks will go to team H. Team H will be awarded 10 marks. The reason is that identification of the organism was not difficult, but yes, since the recommended treatment in patients of retrovirus with a low CD4 count is a combination of a liposomal amphotericin B and a flucytosine. So congratulations to all of you who have participated in this particular round, and we can have a brief summary, if at all it is ready, who all have now scored a little higher or who are now winning. Prabhuji, are we ready with the scores after this round? So it is now team A, team B and team C, and team E and team G. They all are at level 10. Team A, team B, C, team E and team G. Team D, right, so he is at for 20 marks, and team H is leading with 25 marks. So we got many more rounds, and yes, so I think jury, yes, I should have asked in between all the...
Please, return. Yes. No.
Arterial thrombosis, which has resulted in amputation of the leg also. Years back.
It is very debilitating disease unless it is controlled fairly aggressively at the onset. Sometimes it still progresses, and as Sir said, meningococcemia will lead to meningitis and digital problems and kidney problems and multi-systemic disorder leading to even deaths.
Yeah, see, the vascular thrombosis is correct. Here also, if you see the purpura fulminans, it is a dermal microvasculature thrombosis, which is causing this lesion.
The
Okay, so-
chemoprophylaxis is only for short-term duration. But if you really want to control an epidemic, then vaccination is the method.
So Shankar E gets the full points. Can we go to the next candidate, please? This is for you, Vidyashri. So the question is here, a mother brought her 7-year-old child to the OPD because of fever and facial swelling for 2 days. He has not been vaccinated since birth because of his parents' fear of side effects. On examination, swelling is noted in the jaw. Which of the following statements is true? A, meningoencephalitis can precede parotitis. B, salivary gland involvement is limited to the parotid. C, patient is not infectious before parotid enlargement. D, orchitis leads to infertility. Which of the following statements is true? Your time starts, now. And everybody, please respond.
Right.
Orchitis leads to infertility.
Okay. Can we have the answer, please? It is meningoencephalitis can precede parotitis. And can we also, that's a wrong answer. So we have to collect
The correct
the
answer.
responses and correct ones. So D does not get any point, while who has answered it correctly, please?
There are 3 people who have answered it rightly. Team B, answer option A has been ticked. Team A, Option A has been given. And C is given option A.
So three teams gets 5 marks each. 5 marks each. 5 marks each.
Well,
Team
E,
A is
out
Sonu.
the wrong answer from team E, which is given a C option.
So team A, Sonu gets 5 points. Team B, Chinmay gets 5 points. Team C,
5 points.
5 points. Team E,
Wrong answer.
okay, wrong answer.
Yes. One more question. What are the complications of other complications of mumps?
Center also.
Myocarditis,
Aseptic meningitis.
pancreatitis.
In orchitis, euphoritis,
No, then all itis are there. Then
meningoencephalitis,
then
encephalopathy,
what are the other
Pancreatitis.
CNS complications?
Aseptic meningitis.
SSP,
SSP is not.
No.
longer complex.
That is with measles.
Mumps related encephalitis, which is a rare entity.
Then what are the CSF pain is in mumps meningoencephalitis? What pleocytosis?
Sugar low.
Low.
Like
What is the usual cells? Lymphocytes or polymorphs? Lymphocytes. You can be there. Right. How can you prevent mumps? Prevention of mumps. By the national program? Is there a national program for prevention of mumps? National immunization schedule. Which vaccine is given?
MR vaccine.
Can it prevent mumps? No, it is quite unfortunate that still mumps vaccine is not included in the national program. But IAP recommends how many doses of MMR? How many doses of MMR by IAP? 3 doses. When? The answer is right. 9? No, 16 to 18 months. It is 15 months.
Yeah, answer is
And?
because of you.
And? 5 years. Right. Okay.
So we used to see lots of cases of mumps very long back. Commonest cause of meningitis at that time, it is mumps around 10-15 years. When we are giving measles alone, old story. Then we started MMR. Again, now we are giving MMR. So it is again time for we are to suspect. Because we are not giving measles routinely in government. We are working in government institutions, so we are not giving mumps now vaccine now. So again, you are suspect any case with meningoencephalitis, you are suspect mumps first.
We had recent spike in mumps. Everybody knows last year.
Now also we are having an outbreak of mumps now, but still our government is not including mumps vaccine in MMR. See, one more question. Suppose a mother develops mumps during antenatal period. Pregnant woman develops mumps. What are its effects on the baby? Antenatal mumps. Any CNS problem in the baby?
CNS and liver, I would suspect. Transaminiasis will be raised.
One CNS problem. What is the commonest cause of hydrocephalus in a child? Congenital hydrocephalus is acute stenosis. The mumps in the mother can produce acute stenosis in the baby, acute stenosis. Then baby can also have a cardiac problem. What is the cardiac problem seen in babies with maternal mumps? Any idea? This. Say the full name. Full name.
Endocardial fibroelastosis.
This endocardial fibroelastosis, EFE. First one is acute stenosis and second is EFE. Endocardial fibroelastosis. Right.
Okay, we have logged all the points, madam. Shall we go to the third question, which is coming to you, Vijaya? Can we have the question, please? The stool examination shows the following findings as shown in the image. Identify the causative organism. Your time starts now.
Option A, Trichuris trichura vipor.
Trichuris trichura. Okay. We wait for 15 seconds. Can we finish the 15 seconds and then answer? Yeah. And then collect the answers.
Yeah, you're right.
Correct answer.
Trichura is the right answer. So you get full points. None of the others will get any points.
Yes.
So
What is
full
the
points to Vijaya? C.
say Vijaya? What is a problem raised by ticura infection?
Problem.
Yes. What's the problem? Clinical manifestation.
Sir, Vipvam.
And there was an answer here from Chandramohan. But he has not listened to that. You must listen. So the main problem is it can produce a colitis.
Colitis.
Vipvam colitis. And it can produce prolapse. What is the drug
Rectal
of
prolapse.
prolapse? Rectal prolapse. What is the drug of choice?
Metronidazole plus ivermectin.
Ivermectin? Albendazole. Albendazole. Well and good. Okay.
Okay. Shall we go to next question? Next question comes to you, Chinmay. The 3-year-old child has had fever for 4 days and a rash for 3 days. What is your diagnosis? A. Scarlet fever. B. Hand, foot and mouth disease. C. Kawasaki disease. And D. measles. Your time starts now.
Hand, foot, mouth.
Is that right?
No. You can answer.
Hand, foot, mouth disease.
Okay, we wait for 15 seconds and then collect the things. And can we display the answer please?
Yeah.
It is actually scarlet fever, not hand, foot and mouth.
Yeah.
You can see there's a strawberry tongue there.
See,
and
what is the manifestation of hand foot disease? You said hand foot disease. What is the main manifestation of hand foot disease, hand foot mouth disease? Just see the picture.
Yes, I thought that was like inside. I could not see. I thought it was herp angina or something.
Is it herp angina? It's only membrane. It's not herp angina. And what is a rash like in HFMD?
Okay, so rash. So can we finish off the question? Can we get the answers? Who's got the?
Team A has given A answer. Team E has answered A. And team
Krishna, you must use a better glass.
No.
So Chinmay, team B does not get any marks. Team A, Sonu gets 5 points. And who else gets 5 points?
Team D. Yes. And team C, there is a wrong answer. Option D has been picked.
Okay.
See, you should
Team
not talk about wrong answers. You should say about correct answers. No, correct answers. No.
A, B, and E get 5 marks. And B doesn't get any points.
See, coming to the question of hand, foot, mouth disease. What is the type of rash seen in hand, foot, mouth disease? Is it like this? And where is the rash seen? We are seeing a lot of children with HFMD now. What is the type of rash?
Maculopapular rash only we'll see.
Macular is mainly vesicular rash. Where is it confined to?
Palm, soles.
Palm, soles, buttocks.
Now it is called hand,
Elbows.
foot, mouth and buttocks disease. They have changed now.
Very true.
It is hand, foot, mouth, buttocks disease. It's mainly confined to buttocks also. Yeah. And it is a vesicular rash. No, it is not like this. Vesicular rash. And this is a membrane like this. And also it is herp angina. Herp angina also should be there. What is the organism that produces HFMD?
Coxsackie,
Coxsackie?
A16, sir.
Yeah?
A16, sir.
Then?
And enterovirus 71.
Yeah, right.
The most common cause is A16.
What is the problem with enterovirus 71 if it causes HFMD?
CNS manifestations are more with enterovirus.
Yeah, right. It will produce severe disease. It will produce severe disease. Okay, right.
Okay, we have the last question coming up in this round. Can we have the last question, please? Last question is to you, Dr. Somu. A 6-year-old presented with cough for 3 weeks. There is a history of contact with tuberculosis. Which of the following is false? A, most common site of extrapulmonary tuberculosis is lymph node. B, sputum smear negative does not rule out pulmonary tuberculosis. C, most cases of pediatric TB are asymptomatic. And D, Pool's lesions is seen in primary infection. Your time starts now. Everybody else can jot down their responses. Option B, and let us wait for the time to end. He says option D, and that is the right answer. Can we display the answer, please? Pool's lesion is seen in primary infection. A, Sonu. Is Sonu or Somu? Sonu.
So he gets
Sonu gets the full points, and none of the other candidates any points.
Okay. What is the X-ray there? See the X-ray. What are the findings in the X-ray? One of the candidates can say. You say C. Yes. C.
Hilar lymphadenopathy.
Hilar lymphadenopathy. Any other finding? Any other finding?
Prominent bronchoscular markings are there.
What are the other findings you must look in the X-ray in primary tuberculosis other than lymph node? Can you see the
Cavity.
yes?
Secondary cavitary lesions.
In primary complex? No.
Secondary.
Cavitary lesion occurs in a reactivation tuberculosis, not in a primary tuberculosis. Can you see Ghon's focus in the X-ray? Ghon's focus may be seen, not in this X-ray. Not in this X-ray. You must look for a Ghon's focus. Then you can look for fissure thickening. Fissure thickening may be a feature. And main feature should be hilar lymphadenopathy. So what is the treatment of primary tuberculosis? How do you treat? Which category? In the EP, which category?
Drug sensitive tuberculosis type.
What is the treatment? Which category?
Category 1.
What is category 1?
HRZD for HRZD
for
6 months. For intensive phase 2 months, followed by continuation phase for 4 months.
So you say 2HR is a D, followed by 4 HRE. That's the correct. Okay.
And
Thank
also,
you.
So this pulse lesion seen in chronic pulmonary TB, usually in the apical region, and also there is another lesion in the infraclavicular region. What is it called? Asman focus.
Thank you. That ends the third round. And can we display the marks for the third round, please? End of third rounds. So we have Sonu Prajapat on 30, Chinmay on 30, Vijay is leading at the end of the third round with 35, Vidyashri is 15, and Shankar is on 25. You still have the buzzer round going where you can score points. And best wishes. Can I request Madam to come in again?
So this is going to be a very interesting round, the buzzer round. So all of you have got buzzers with you. So when we ask a question, yeah, we are just getting it checked.
So that everyone will be familiar with it. You can see perhaps the buzzer can be near to you.
So what we'll do is I'll ask Dr. Yagnesh to give a buzzer round demo question.
Yeah, before
Please give a demo question for the buzzer round from your end. Yes. Just ask them anything. And let's see who presses the buzzer.
Yeah, before that, I'll just see all of you can see there are buzzers kept in front of you. And right now, there's a blue kind of a light display. That means the buzzers are active. So just place your fingers onto it. Don't press, just place your fingers onto it. It's in action. Okay. So if you press, whosoever presses the fast, that glows in green, and the rest of the buzzers goes off, light goes away. And since already she has pressed it now, that buzzer, team D buzzer is on now. If E wants to press it again, it will not, because it will not function. That means that is the fastest finger. So that is how the buzzers are placed. Unlock money.
Okay. You gave one question.
So one general question. So
General question, whatever is your choice.
okay. Okay. Now
You took so much. The rest of the people.
see, for that trial question, the team C buzzer is glowing with green. The rest of the buzzers are off. Even if you want to press it now, it will not, because you are the second fastest or the second finger there. Clear, all of you? Sir?
It won't pass.
So
Fine. So we are comfortable, all of us? Huh? Yeah. हाँ, 5. ठीक. So whoever answers fastest will get 5 marks, okay? And as per the advice of the jury, we are not keeping any negative marks. 5, yeah, that I've, Oma, you please note, it is 5 marks. Okay, so I think all of you are comfortable, clear? Don't press now. Don't keep your hand off. Okay, otherwise we will not know. Huh? So you let the question be completed and then you press the buzzer. Huh? Okay. Huh? ठीक है? Just keep your hands on top of the buzzer but don't press it. Should we start, sir? Yeah. Yes.
If they press the button before you finish the question, then disqualified.
Disqualified?
Or you don't read out the question, just let them see. Just display, madam. No need to
Just
read out.
display?
Yeah.
Okay, and then let them read and within 15 seconds. Okay, Uma, you got the point? When the question comes, you just display you start the timer also. Okay, so kindly display the first question. So your time starts now.
Ma'am, Lyme disease.
Okay. So the candidate B, Chinmay Jaina, buzzer, yeah, green. So he has answered Lyme disease. Okay. So this is the correct answer. So Chinmay gets 5 marks. So you want to add anything, Anand sir, on Lyme disease?
No.
Lyme disease, yeah. You can't see, no? He is having a problem. Can we shift this a little this side? Podium को थोड़ा इस तरफ कर दो.
Crew team.
He is not able to see the option neither from here or from there. It is coming, but again he is having problems. So otherwise, what you can do now, you can shift the candidate. Or podium you can put it. Podium to shift.
See, Lyme disease is not a very common disease here. We are not very familiar with Lyme disease. Lyme disease usually present with a skin rash, and meningoencephalitis is very common with Lyme disease. Okay.
Yeah. So with that, I think we will move to the next question. You have deactivated, okay. So we go to the next question. Can we display the next question, please? Who pressed? Okay.
Yellow fever.
So did you read the question or you just pressed? So we'll allow the audience to answer.
Yeah.
Dengue fever. So you see, you should read the question properly, huh? Dengue. Breakbone fever is dengue.
No marks.
So no marks will be
No marks.
given. This goes off.
No marks.
No marks. So you want to say why it is called breakbone?
Why
fever?
it is
Because
breakbone
they
fever?
are confused with chikungunya.
Why it is breakbone fever? Yes? Because of fever?
So otherwise you'll not get marks.
What is it, madam? What is the confusion? Yes?
So they are saying that she didn't answer correctly, but we answered. So why we did not get the marks?
But she was first.
To press the buzzer.
You should.
Before seeing the question, he already pressed, so that is green, and then they read the question later on. So that's a fallacy.
That's a fallacy of this round.
That is a fallacy is there.
Negative mark.
Yes. Yeah. So what you do is you please, now all of you read the question first.
Then plus. Then plus.
Or I think what I should do is I'll read the question. When I finish reading, then you press. Okay. Okay.
Okay. Right.
So we go to the next question. No. What is the classic triad of symptoms in Rocky Mountain spotted fever? Fever, rash, history of tick bite, cough, weight loss, night sweats, fever, jaundice, hemorrhage.
Option A.
Option A. So can we display the answers, please? Yeah. So the correct answer is fever, rash, history of tick bite. Pardon? You were supposed to do it till the last option.
See, the madam will say the question, madam will say the answer, then you start pressing. Not before that. Not before that. Not before.
Not before.
Finish reading, then the timers will start. And before timer, nobody should press the button.
So I'll take a mic from you.
This also is cancelled.
This. Name, no
Yes,
marks.
Yeah, cancel.
Cancelled.
But you should have enough questions.
No, we have, sir.
Okay, then that's all. You cancel.
We have.
You cancel.
Anyway, it's a buzzer round.
Yeah.
So now is it clear? Huh? If you press the buzzer before I finish, then you're disqualified.
Disqualified.
That's why we wanted negative marks, sir. That's why.
Now we will not follow negative marks, madam. You.
We'll go as
Yes,
such.
as such. Okay.
Okay, next question.
So are you clear that when I finish reading the last choice, the timer will start. During that timer will start, then you press the buzzer, okay? Can I have the next question, please? Which cytokine is primarily responsible for the febrile response? A. Interleukin 4, B. Interleukin 1, C. Interleukin 10, D. Interleukin 12.
Option B, interleukin 1.
Okay. So this we will take because she has pressed the buzzer after I finished the question. So the answer is B, interleukin 1.
Right.
Fine? Huh? The first valid question. So
She
C
gets-
will get 5 marks. Okay. So Vijaya will get 5 marks. Fine? So you want to add anything on the other interleukins
No.
which are displayed? 1 and 6. Yes, and TNF. Right.
And interleukin 10 actually it will reduce fever.
It will reduce fever. Yeah. All right.
Interleukin 10. Right.
So we will go to the next
Yeah,
question.
right,
So we go to the next question. This is the first question, which is valid. So 5 marks to C, Dr. Vijaya. We go to the next question. Uma, can you display the next question? Endogenous pyrogens include all of the following except interleukin 1, interleukin 3, interferon beta, interferon gamma. Okay.
Ma'am, interleukin 3.
Interleukin 3. Can we display the answer, please? Yeah, so he gets 2 marks. Why you said interleukin 3?
I ruled out the other options.
Right.
Very smart. He ruled out the other options. Because, sir, you already told the other options. So, this marks goes to Chinmay Jaina, 5 marks.
B, yeah.
Okay, answer is B. We'll go to the next question. Zyada nahi hai, sir. I get totally covered by the podium. The next Janam, I have to tell God to make me more 1 foot more taller. You do. Okay. We will go to the next question. Yeah. Uma, can you display the next question? Yeah. Most common cause for serious bacterial infection in neonates and young infant. A. UTI. B. Upper respiratory tract. C. Meningitis. D. Gastro. You have pressed first.
Meningitis.
No. Huh?
It's UTI.
So as soon as I finished, they pressed. So it's valid. UTI. What about you people? UTI. So rest were all correct. It's wrong.
Yeah. Yeah, why? See, UTI is a very severe infection in newborn. Why? Because in most of the children with UTI, they may have associated obstructive uropathy. We've seen that more than 50% of newborn and in early infancy, UTI is associated with obstructive uropathy, with like posterior urethral valve, vesicular ureteric reflux. I think our friend nephrologist is here.
Think what we are missing a lot of UTIs, and the symptoms are very non-specific, and that is why we do not think of UTI. But as all of you are correct that UTI should be thought of in a newborn and a neonate whenever the child is having a serious infection.
So the catch in this question was, you have told us the most serious bacterial infection, but the catch in the question was most common cause. Okay? Yaad rahega? Theek hai. So nobody gets any marks in this question. Can we get the next question? All of the following criteria are used to identify febrile infants at low risk for serious bacterial infection, except Boston criteria, Philadelphia criteria, Rochester criteria, Ranson criteria. Okay.
All are first.
Philadelphia criteria.
No, ma'am. Option D, Ranson criteria.
So, Ranson criteria. So, wrong. Okay. Can we display the answer? So,
okay.
Yes, sir. You want to add on the Ranson criteria, any one of you?
So, where we use the Ranson criteria?
In up to 3 months, infant for diagnosis. I don't know Ranson. I rule out.
Use it in the pancreatitis.
Yes.
Sir? No? Fine? Okay. So, nobody gets any marks in this. We go to the last question of this round. Which virus is commonly associated with viral hemorrhagic fevers? Adeno, dengue, rota, rhino.
Dengue virus.
Before. So, you're correct, but we will not give you any marks. Why you didn't wait for us to finish? You want to add some more questions? No? ठीक है ना? One. Okay. Okay. Yeah. So we'll have 3 more questions. Okay. Are they ready? So this, nobody gets any marks. Huh? Actually, in other quizzes, we give minus if you do like this. So Uma, can I have the next question, please? 3 more. So which symptom is most commonly associated with dengue fever? Lymphadenopathy, hemorrhagic manifestations, encephalopathy, muscle stiffness. You did not.
You should not see. No. Candidates should not discuss like this. Only jury can say. No, we are watching it. No discussion for candidates. No discussion.
No.
Final is by jury. No.
Sir, what to do? He pressed first actually before I finished. And what was your answer? Muscle? Stiffness. No, that is not the correct. Huh?
So
He
we
pressed early.
cancel it.
We cancel this question. The actually correct answer. Can you display the correct answer? So actually the answer is hemorrhagic manifestations. Okay. So don't be in a hurry to press the buzzer without understanding the question. Huh? Sure, sir. Huh?
Because 2 questions are there.
Negative marks. Okay. So think before you press. Huh? Yeah. Okay. Yes. This is the fallacy of the buzzer thing.
Okay, now
Yeah. Next, can we have 2 questions? Last 2 questions. If they press the buzzer before time or they press the buzzer and they give a wrong answer, it will be negative marks. Okay? Yeah, please watch them. Okay. Please give the question. A child with fever, rash and lymphadenopathy is diagnosed with infectious mononucleosis. Which of the following laboratory finding is the most characteristic of this condition? Positive blood culture, positive heterophile antibody test, elevated C-reactive protein, elevated liver enzymes. Okay. Positive? Okay, so this is valid. He gets 5 marks. Positive heterophile antibody.
But this positive heterophile antibody test is also not very specific for IMN. You must look for IgM antibodies against Epstein-Barr virus should be looked for. And
out of these choices,
I'm telling you, out of this, the best answer is positive heterophile antibody test, but it is not very specific. And elevated liver enzymes you may see in 75% of children with IMN. But clinical jaundice is very rare.
Very rare.
IMN.
Okay. So 5 marks goes to Dr. Shankar. So we come to the last question of this round. A 5-year-old child is found to have propyridine deficiency. Which of the following disease is highly susceptible? A. Meningococcal, B. Pulmonary tuberculosis, C. Staphylococcal pneumonia, and D. Cryptosporidiosis. Okay. Shankar. Huh? Staph. Okay, this is the wrong answer. So display the right answer, please. So you get -5. Okay. So Shankar, whatever you got in the first question, you minus it. So the correct answer is meningococcal infection. So you want to add on this propyridine deficiency?
No, I don't want.
Anand sir?
Propyridine deficiency is a primary immunodeficiency disorder. Usually have a deficit in the complementary proteins. Yeah, complement pathway proteins. So it is the most common is the meningococcal, invasive meningococcal disease. Is most common.
So
What are the other conditions where you can get invasive meningococcal disease?
practically what we are seeing commonly is nephrotic syndrome. You have to give prophylaxis against meningococcal vaccine because propyrin factor and the complement factor is loose in the urine. So we have to give vaccine in addition to all capsular organisms, including meningococcal.
So if you have an asplenia or a splenectomized patient also, they will be more common. So thank you very much.
Madam, 1 minute. In
yeah.
the primary immunodeficiency, it's a kind of presenting as a X-linked recessive. So it's only common in the male children.
Male child, yes. So before they display the results, any other comments, sir? Vishwanath, Dr. Vishwanath?
Thank you very much.
Finish.
End.
If now we'll see the scores. If there is a tie, then only we'll go for a tiebreaker.
Yes, madam, I want to make a comment.
Yes, sir.
As a professor of pediatrics and as a teacher in pediatrics for the last 50 years, I have a lot of students I have seen, and I request all our PGs to read more.
Yes.
You must read more. And as pediatric PGs, you read Nelson from first page to last page. Yes, you read it.
Isaac, sir, what about medicine? Should we also read the medicine books?
Definitely, you must read Harrison. Harrison is your Bible, so you
Yeah.
have to read it.
Because now we are seeing up to 18 years, no, sir?
Yes, yes.
So Harrison also we have to read.
But now the students, they don't read Harrison and Nelson, they don't read. They read only local books.
Local books.
Yeah, small books.
Small books.
Small books and whatever is present online.
Online.
But
We didn't have that luxury at that time.
So if you go online, you'll make a mistake. Suppose you Google the question we asked about diphtheria, no? What is the most common complication of diphtheria? You just see what it says online. It doesn't say respiratory failure. It says myocarditis. So that is the fallacy of reading online.
But that is the requirement of examination. That is what is the issue.
My request is that at least we are older person, but at least read the hard copy once. You are just reading soft copy and it is disappearing like that from your mind. Because I studied in lesson 88, still 15th chapter is cardiovascular system, 20th chapter is nervous system, 22 chapters, everything I know still now. And I know which page it will come like that. So I think you read at least once in hard copy. While traveling and little hours, you can read the soft copy, that is true. But you should read a hard copy.
Yes, so you want to say something?
Yeah, thank you very much for all the participants and everybody gathered here. We have finished the rounds, all the 4 rounds, and let's have a look at the score.
Final scores, please.
If there is any tie, we have a further tiebreaker, and I hope we are not put into that tie-breaking situation. Only
Yes,
those
only
two.
those.
Only those two.
What are
Only
tie?
those two.
Just before the final scores, the scores has been validated from the system, from the independent juries, as well as the other people from the back-end scoring team. We have validated and found to be correct. Answer for your final.
Thank you. It was an excellent exercise for all your PGs.
Sir,
I think.
before we do the final scores, can I just distribute the gifts to the audience?
Okay.
So who had raised hands? So who had answered? What do we have for them? Something nice?
Chocolates.
So only 2 people answered?
Yeah.
Yes, sir, you are there. Sir, you are going to get 2.
Not for the experts, not
You are
for the
going to
experts.
So he is the lucky one sitting next to you. Rest of you didn't. Okay. So how many we have?
Palaravan is sitting there.
So we are giving it to the
All the juries
all
and
the juries, sir. If you don't eat, you can give it back to us.
Okay.
All are diabetic? Doesn't matter. So now we can display the final scores, sir. Yes, sir, please.
Right, excellent exercise by all the PGs, and most of you had done very well. And as already suggested by the senior, that you must do a lot of reading, and reading is the only thing which will make you perfect. And I'll start with these scores. So, Dr. Vijay Shri, you have got 15, and keep it up. And you need a little more intensive exercise. Then Dr. Shankar, you have 25 marks. You lost 5 marks in your buzzer round. Otherwise, you could have got 30 here. 25 marks. Well done. Then Sonu, you have 30 marks. And well done, Sonu. Again, keep it up. And after that, Dr. Chinmay, you have 35 marks. And you had answered most of the questions very well. And at the top, we have Vijay with 40 marks. Very well done. All of you are winners, as already said, but one had to score more, and Vijay is the one, and second is 35 marks Chinmay, then 30 is Sonu, and 25 is Shankar, and 15 is Vijay Shri. Right?
Chinmay is 35. Chinmay is 35. No, the display in the second thing was wrong.
Chinmay is 35, yeah.
So thank you very much, sir. Closing remarks. Dr. Isaac, the independent.
Take a photograph also.
Yes, yes.
Do photograph.
With them.
So I think we enjoyed this beautiful session in the morning. I must also congratulate the quiz masters because they have done a good job, right? So I think we will give a clap and congratulate them for the good work. And we also thank the experts for giving their opinion, because it's a learning process. It's not just a competition alone, it's a learning process, and we have learned lots from what discussed. I think congratulations to all the people who participated and the winner also. Right, so do well. We'll continue to have such quiz programs in the future also. I think we must raise our standards a little more higher, and we'll be able to see better outcomes. Please remember what we said. Continue to read Nelson and continue to read Harrison. Right? Okay. Thank you.
Congratulations, Dr. Vijay, for an excellent performance. Dr. Chinmay, to you too. Almost everybody was good. But as you said, there is a caveat in the Gujarati. I will translate later in the English or Hindi. Dasarana divse godu na dode. That means that day when you require most, it will not work. So I have no doubt all of you are learned individuals, you are learning and you know major thing. But at the time of pressing a buzzer, you may be a little late for a second or two and you miss the bus. So do not worry and do not get disappointed by losing. It is not a matter of winning or losing. It is a matter of learning, and it is never ending process. Even today, we are learning. I also learned a lot from your quiz. So learning never ends. So you please continue to learn and let us have a bright future we wish you a bright future for all of you. Thank you.
It is a very good teaching experience already mentioned. And as I told in the beginning itself, all are winners. And the losers also winners, because recently myself and Dr. Anand lose the election. So it is not a problem. We are enjoying it. So that is why we came here to enjoy it. And I think I have some request to organizers. The round everything, there's some promise that we will discuss later, and we will rectify it. Krishna is here, no? Rectify it next time. Okay, thank you. Congratulations.
I would just say that participation is more important than winning. And you all have participated very well with full energy and full enthusiasm. And that is what matters. Thank you.
So the quiz masters, any more? I think we learned a lot, no?
Participation is good, as everybody said, and I hope you all enjoyed this. It is not just that you participate, but you also enjoy. Enjoy plus the learning. The bigger faculty is here, esteemed faculty, and we learned so much from them. So much that we have actually learned and forgotten, and it's just come up again. Thank you very much, everyone.
Want to say something?
All the best for all.
Thank you.
So what we'll do is we'll have a photograph here, and after that we will move to the Mysore Hall for the felicitation of the winners. So just arrange for the photograph. But the background should be made
सकते हैं to see. Okay, so green light will be there. We have a timer here also. So ये आ रहा है ना कौन कौन सा नंबर आया? Just let's see. We'll start again. Who is the president of India? Just press it. Everyone again. Can we again? It's coming 6. 6 is F. देखो F का green हो गया. Okay? नहीं इधर आ रहा है हमारे पास. नहीं I have a number here. Okay? So there will be no some technical is there. ठीक है ना?
We are fine, sir.
मैं ये प्रेस नहीं करूँगा मैं आप लोग.
Their number will come here.
अगर बस बस करके भी नहीं होता तो you raise hand मैं बताऊंगा करके या मैं बताऊंगी girl is also there.
I hope you are able to read it because it's very small to read.
Nothing wrong with this.
When we are putting a question, do we need a video here? We can make videos there, so it's looking very small, na? Can you remove the video from the screen? This is better.
Age day and mind defense also. We will give equal opportunity to everyone. So are we ready? We have a timer here. You are here. This will show. But still, if you feel you know the answer, stand up or raise your hand. Okay? We don't want to wait for this technique and all. This is also, and then you can stand up also. Okay? Don't worry, and don't be very tense. Okay? Only 50,000 is there, nothing more. It's not a big amount. Just 50,000. Although I feel it's a good prize money, ma'am. Thanks to Fefcon, and it was kept secret till you came here, and we also knew just that it's a good prize. So we'll go to the question number 1 slide already. Computer ji or Prabhu ji. There will be 8 questions. Just first read it, okay? So I will read it for you. Identify the disease and lesion figure A to 8, okay? A to D. 51-year-old woman presented in her primary care physician office with a 2-month history of increasing weakness. She started experiencing weakness in the gym, especially with overhead exercises. Since then, she had been increasing difficulty during activities of daily living, such as reaching overhead and going upstairs. She denies any fever, weight gain, loss, or any other motor deficits. Physical examination revealed 4x5 strength in her deltoid, quadricep, bilateral. Anybody who want to buzz, they can buzz also. No other motor deficit are noted. Laboratory evaluation, CPK is raised, ANA is positive anti-MI2 antibody. Which of the findings shows in the figure would most likely also be seen in this patient? Is it A, B, C, D? So what is that thing which correlates with this disease? Okay? So anybody else buzz? We can have another slide. We can have another slide. We can have another slide. Next slide. Prabhu ji, एक slide और दिखा दो. So answer is either A, B, C, D, and who is the buzz? A. Team 2. Sorry, team 2. So he will get the chance. If he is correct, he will get 10 marks. If it is wrong, -5. Okay? So he has to tell what is the disease which can correlate with skin, this lesion A, B, C, D, either of 4, and what is that disease as such. Okay? If he is completely answered, 10 marks, otherwise we can have 5 or whatever. Let's see. नहीं अगर पूरा नहीं बताया उसने डिफाइन ही नहीं कर पाया तो क्या मैं ABCD कर दिया तो चलो लेट्स सी कंप्यूटर की नेक्स्ट स्लाइड करते हैं कोई है नहीं प्रभु जी आंसर बता दो चलो ओके 2 dermatomyositis and which figure ABCD
Figure A, Gordon's papules.
ABCD which one was there कंप्यूटर जी ब्लैंक नहीं नेक्स्ट हाँ ये देखो इसमें बताओ
Gordon's papules.
Gordon's papules are there and he said dermatomyositis which is an inflammatory myositis And computer ji, is it correct? Gets 10 marks or not? Next slide. So exactly, he's correctly said, dermatomyositis is a maculopapular rash over the knuckles, which are called Gauton's papule, and they may have other signs also like Saul sign, they may have a heliotrope rash, and the trick was raise CPK. So during question only, he could have make it out that it is a inflammatory myositis. Very good, and fever is not very common in this, but they come with proximal muscle weakness. Okay, so he didn't give any offer to our audience to answer. So he gets 10 marks, computer ji, just register this. So we will see this also, okay? So everyone ready? So in between also you can buzz it if you are very confident, but we will run all the question. We will not stop because we don't know that what exactly you are going to think, but sometimes you can think also. Computer ji, we will go to the question number 2, everyone ready? Identify these two famous gentlemen or their reason for fame. They are in news for last few months. These two gentlemen, you can name them or why they were in a news. Okay? Anyone want to take an option here? We'll go for clue number 2. Nobody want to take chance. Okay, computer ji, second slide. They are scientists who work on RNA. Kindly name the scientists or maybe their institute only. They are famous for something, either option 1 you will take, an institute where they worked on RNA. Anybody want to take chance? No, 21 seconds, no. So should we go to next option? This is easy, we have made easier for them. Okay, out of 4 you can choose one option. Which RNA they worked on? Team 6 or F has buzz first. Wait a minute, okay? So he is going to answer for 10 marks, otherwise he will lose 5 marks. So 6th number or F, okay? Okay, you go ahead, F.
microRNA.
MicroRNA. Why did you think microRNA? Otherwise messenger RNA, transfer RNA, we heard more. Why did you say microRNA? -5 भी हो सकता है ना?
So there have been some recent developments regarding microRNA therapy.
Very good.
That's why. But
that's why you think it's a microRNA. So we made it slightly easier, and there's a microRNA written also there. You can see bold thing. So thoda sa if you think that something is microRNA, but this question will go to audience for a chocolate. Why these two guys were famous? Yeah, Dr. Jayan got the prize. They were a Nobel Prize winner for Physiology and Medicine for this year 2024. Can you have another slide? Sir ने hand raise नहीं किया, direct answer कर दिया. Next slide. So these are the 2 people who got the first Nobel Prize for this year, and they won $1 million. 1 million will be equal to 10 crore at least. Sir के लिए sir topic. Sorry, chocolate sir. So they won the Nobel Prize, and their name was Dr. Victor Ambrose and Dr. Gary Runkum, and they are from MIT, Massachusetts University, and from the US. So I was thinking even MIT you tell Nobel Prize, we would have given 10 marks, but still he got 10 marks because he could make it is a microRNA, and now recently there has been a good number of studies that microRNA plays part in disease, cancer and all. They are related to protein translation. They can change which protein has to be produced and which not. So good to know that both the answers has been correctly answered.
This is a technology which is almost 30 years old. This work is almost 30 years old.
Yeah, it's very old, sir, yeah.
1993, and this was used for the COVID vaccine.
Yeah, microRNA same technique.
We could prepare the COVID vaccine so early, utilizing the microRNA technology. That's why the 1993 work was recognized in 2024.
Exactly, sir, exactly. So microRNA was helpful in making a COVID vaccine, and just keep on reading newspaper also and see who wins Nobel Prize. But you just need an inspiration to do research and all. $1 million is nowhere. Next 10 years you will be next Nobel Prize winner from India. Okay, so we'll go to question number 3. Computer ji. It's a pap smear of a female with vaginal discharge. Identify the cell at the center of the smear or maybe disease. Anybody want to take option? Yes, sir. Wait a minute. So you want to give answer either disease he can tell or what cell it's visible, okay?
Sir.
Agreed?
Yes, sir.
Okay, go ahead.
Sir, it is clue cells.
Very good, clue cell. Which one is clue cell? That white one or the dark one?
The dark.
Okay, it's clue cell. Okay, dark one is a clue cell because one cell is different. And which disease causes this clue cell?
Bacterial vaginosis.
Bacterial vaginosis. Okay, it's very surprising to know that medicine person knows STD and all. We should know, but still, sometimes maybe MCQ and all. We can have another slide to check if this answer is correct or not. Second slide. Okay, the word clue was the clue in this, and he already picked up in first slide only. And we can go to the another slide. Yes, it was bacterial vaginosis only, which is commonly caused by Gardnerella vaginalis. Antibiotic which we can give is this thing. Where was this written? Okay, so metozil and all we can give. And one of the diagnostic criteria we use this clue cells, which suggests that a cell which is totally damaged by bacteria, there is no cell wall, no nucleus is seen, only some fuzzy cells is seen. That is called clue cell. Very well taken by team C. Question number 3 was there. So he gets 10 marks. So all 3 has been answered. So chocolate is only given to Dr. Jain. Nobody has won any chocolate yet. We still have 7 more questions, and you still have 5 red. Yeah? So you still have 50 marks to win. Okay. So you can buzz. I think easy question. You can get slightly more faster and faster. Computer ji, we can go for question number 4. Diagnosis of pneumonia is usually clinical, but sometimes it can be diagnosed or confirmed by urine test. Which of the following pneumonia can be diagnosed by a urine test, antigen test? Your time starts now. They have option A, B, C, D. So it's the MCQ. H team has first option given. Just wait a minute. So this will be offered to H team, Dr. Mayank. Okay. So antigen test, one is with 2 hai. Get both the test, then you get 10 marks, otherwise 5. Okay. And if I don't know if one is correct and one. Okay, he knows both the things. Easy.
Legionnaire, Streptococcus.
Strep pneumonia and Legionnaire pneumonia. Okay, good. And I think it's correct. Computer ji, can we have the question? Answer. Sorry, next slide. So both the thing is picked up. Otherwise, MCQ usually pick one only. So it is the test where even pneumonia, you can do a urine test and say patient is having pneumonia, because a lot of strep pneumonia we are not able to diagnose with a sputum test or even bowel fluid and all. It's difficult to cultivate. Antigen test is available, and he get full marks, 10 marks for this answer. Very well taken. Mike, we are really impressed with that, and very fast. I think, I don't know, second, less than 10. Okay. So all 4 questions has gone to different team. We still have 40 marks to go. Okay. So next question starts now. Question number 5. Computer ji. Which of the following statement correctly differentiate disseminated intravascular coagulation DIC versus thrombocytopenic purpura or TTP? One of the statement is correct, rest all are wrong. I will read one by one. You can buzz if you are very. DIC is correct by a marked increase in platelet count, while typically present with thrombocytopenia. D or a 7 team, I think G team has already clicked it. And TTP is associated with deficiency of a von Willebrand factor cleaving protease, while DIC is often triggered by sepsis or a trauma. DIC is primarily result in microangiopathic hemolytic anemia or MAHA, while TTP does not cause hemolysis. TTP is commonly associated with prolonged prothrombin time and activated thromboplastin time, APTT, while DIC typically shows normal PT, APTT. Or a 7th candidate, I think. Option B, C thinks that TTP is associated with the deficiency of von Willebrand factor cleaving protease, whereas DIC is often triggered or by trauma and sepsis. This is the correct statement, right? Okay, so that means sometimes these both comes with a thrombocytopenia, like first statement is wrong. Sometimes you need to differentiate between TTP and DIC, how to differentiate. And it's very difficult sometimes, and treatment is different. While DIC and sepsis and others are treatment, while TTP you need treatment by, what is the treatment for TTP? Plasmapheresis. So we rarely do plasmapheresis, but in these cases we do plasmapheresis. And what is the test which is detect this von Willebrand factor? Sorry? Protein test or ADAM something, ADAM ST 13. We can have another first answer, please. Computer ji, Prabhu ji, can we have the answer? It's the correct answer. She gets 10 marks. And the test which is available to detect TTP or microangiopathic hemolytic anemia is, Computer ji, next slide. So you can do ADAM STS13 test, either activity or level you can see, and diagnose that it is a TTP, while DIC you will have PT, INR, these things are derived in that. So very important in a patient, very sick patient, thrombocytopenia, sepsis, you need to differentiate among that. And good thing is we have one more person in the this round 4 who got 10 marks, and now we are left with 3 more questions. Okay. So if there is a tie break among first position, we will have one more question. The buzzer, that person have a answer. If we have a tie break at second level, we have question 4. Because we don't have a third. Okay, so question number 6 will start. A 45-year-old diabetic hypertensive male presented with acute onset swelling of pain of first metatarsal of right. Which antihypertensive drug should be avoided in this patient? We are not asking for diagnosis. And F team has buzzed first for 6. And F team, Dr. Ranjan is there. Want to know drug should be avoided in a patient first MT. Okay, first option. Then we'll ask why did you answer this. Okay, you go ahead.
Is furosemide.
Goes for option number A, furosemide, which is a diuretic, I think. And why do you want to avoid furosemide? Why not enalapril? What do you think? What is there in the first MTP? What is that condition called? Gout. Okay, first MTP involvement is called P. Something good disease of the P. Podagra, we say podagra. So podagra, treatment of choice is podagra otherwise? It's acute gout. So painkillers will be a better option or a steroid. But your answer is correct. I think Prabhuji will tell us if it is correct or not. Furosemide. Okay, its answer is furosemide, correctly said. Because furosemide causes increase in uric acid, that will aggravate his gout. That while enalapril can decrease the uric acid level, and rest of others are more of a nothing to do with uric acid level. We'll avoid furosemide in this acute condition gout, and although main treatment was something different. So maybe a culprit drug is furosemide in this patient, which has caused acute flare of gout. So we are left with 2 more questions only. So Bismarck sought to win or lose. Next question, we'll go 7th, then we'll what is the option there. Question number 7. Identify the febrile disease. It's a febrile disease. Okay, we'll get a lot of options. Just wait, don't buzz. I'm saying 8 ने पहले बजा दिया. We have not started the. Wait a minute. We'll have a lot of options. Just wait a minute. Should we continue? Because now you have to answer. Okay, just read it now. This disease is commonly seen in children, adolescents with recurrent episode of high-grade fever, which lasts for 1 to 3 days with April. They have serositis, acute abdominal pain. They can have rash. They usually present as a PO, undiagnosed for years. Okay. You want to answer immediately? You have 9 options there. You can read it. Okay, you can. Familial Mediterranean fever. What is that? Some genetic study is also positive. MEFV. What is that? How to confirm familial Mediterranean fever? कैसे कंफर्म करेंगे? You said the option. हाँ, you said familial Mediterranean fever, na? It's correct answer. But how to confirm it? I suspect that person. I say it looks like a familial Mediterranean fever because he has acute sinusitis, his acute abdominitis. We had one slide previously also. So how to confirm it? कैसे confirm करेंगे? Diagnostic test. Others will like to know कैसे confirm करेंगे? You should have a confirmatory test, na? One is clinical suspicion, then you confirm. Full marks, don't worry. You're given a correct answer. That is a pyringine mutation. ME stands for Mediterranean and FE stands for fever. So this is the mutation. You can do a mutation study. In codes for pyrin. Okay. Pyrin stands for. Waited for coming this. But computer just let H is Dr. Mayank. Correct answer? Yeah. The correct answer, familial Mediterranean fever, and he picked it very early. Before even we started first option, he's already. So this was for team number 8. This is the last question, okay? Last question for this. Can we have the total mark system so that where they stand? Okay. You all know your score and your maths is good. So still you can see H has 45 marks, 40. Everyone is very nearby. Anybody who gives the correct answer will may be the winner, and if he gets wrong answer, it may be a minus mark. Okay. There will be a tie-break question after that. If there is a tie at first position or second position. Okay. So this is the last trial for everyone who is in 40, 45, and 45 can become 40 also. Okay. So we will start with the last question. Everyone ready? This is the last question for fever quiz. We'll start with the familial Mediterranean fever. Is next question. Okay, this is the figure. We need a one answer for one word answer. Correlate the below three pictures. Diagnose name of the disease. There is an airport there. It is written Netaji Subhash Chandra Bose International Airport. There is a slide. Some person is doctor is sitting something in microscope. There is a bullet. So I think F team has already made an announcement. Okay, so all three has to correlate it. There is a disease can be correlated with all. Make it out team F, or you need more clue. You can have one more clue otherwise. You want one more clue? Question pura. Yes. Next clue. Answer. Answer bata do chalo. Sorry. Answer. He wants to say leishmaniasis is a disease. Okay. Leishmaniasis matlab ho gaya kala azar. Very good. And how does leishmaniasis cover? उसमें वो डॉक्टर साहब का नाम लिखा हुआ पढ़ पा रहे हो शायद छोटा सा लिखो पढ़ो. Can you read it? Can you read it? You can go backside also. You can read there. Correct answer is the correct answer. Bilkul. There written is the gentleman is Sir William Leishman. But how come Leishman comes in picture of these three? How come Calcutta airport is there in Leishmaniasis? Gentleman, the British, I think Irish, and the bullet. Picture. His guess is right, but I needed a one word, but I will give full marks. 10, 6 or a F. Dr. Nilanjan wanted a word, but it's and there's another name for Leishmaniasis. That is the term we want. One more. Correctly, Dipurajan has sent what?
Dum fever, and that bullet is dum.
So this airport was previously known as Dum Dum Airport 1995. Can we have another slide? So this was Dum Dum fever, which is leishmaniasis only. And this is the gentleman there who got this disease first diagnosed. And this was 1904. There was British Army team or an Indian Army team. And this bullet is called Dum Dum bullet. It expands when you fire it, it expands and do a lot of damage. So a lot of people say don't use it. Wanted to know the term Dum Dum, Dum Dum bullet, Dum Dum disease, which was diagnosed by Leishman, and Dum Dum airport, which is now Netaji Subhash Chandra Bose. But correctly answered. I think most of the question, everything is answered by these guys, all 10. Can we have the final score of this round 8? Juries can have some. Sir, any comments and all? Okay, can we have the score, Computer G? Team F has won by 50 scoring last Dum Dum question. And we don't have a tie break here. There's no tie break, so Team F, which is Dr. Nilanjan, has won the quiz 2024, and he won 50,000 bucks. And second is Dr. H, Dr. Mayank. Rest all has very well participated. Equal. And it was almost like a tie break. Last question was a tie break. That's why I kept the last question. Just take time, take a breath. And he correctly put up Leishman's also. Can we have one last question for audience? Because nobody has taken chocolate except for our jury. I had a question for tie break also. So this is for audience. Last question. Not take much time. Computer Ji, Prabhu Ji, last question for audience only. They will not answer. Okay, this is another picture. Just view it. No more slide will show. This is the last slide. And if you don't answer from the audience, we will ask the our participant again. It's again a quiz or a puzzle. Can you connect these three pictures together with one medical name? One of the medical name, it may be something will give more clue. The picture of somewhere in America over Trump land. There's a lot of Kansas City, Oklahoma, and Memphis, St. Louis. There's a river going, and there's a stain. A lot of stain was shown by Dr. Ramesh also. This same slide was there. You can see the HNE stain, round some microorganisms is there. There's some brown fudgy there is there. Can anybody from audience correlate what can be a medical name? Something related with super basic. One clue. Next slide. Can we have next slide? So it's an antibiotic. But audience has to hand raise or just they want to name that. Second clue is related to Mississippi River bed. I think nobody is doing it river bed. Mississippi मड टाइम से कोई आइसक्रीम भी आती है बास्किन रॉबिन्स में when you go back related to that anyone from here want to name that antibiotic we have that microorganism also where it is effective. This HNE stain which is gram positive cocci are there. Correct sir. Which gentleman sir gets a chocolate. Next slide. So it's used as an MRSA organism. Endocarditis. So I've taken that slide from there and we can have another slide. Next slide, Computer Ji. So it was vancomycin which gets its name from mud because initial preparation were very brown and very dirty type of thing and it was invented somewhere in US. They still call it Mississippi mud. Also it's a Mississippi mud. You can just Google it and check it. So this was for audience and 2 chocolates we have given to audience. And it was very interesting and very interactive quiz I feel. We have 2-3 more questions but I think there's less of a time. We will have more award winning session from our team. And congratulations to all the participants, especially winners and also for participation from all the colleges. Thank you. Dr. Manjula and juries, sir. Yeah. I would like to ask juries.
Dr. Sudarshan sir and Dr. Jayant, Dr. Anupam.
Come here, come to. Thank you. We should thank Fever Foundation for the initiative and for all that has been done for the online quiz and for bringing you all here to this program final at Bangalore, which was a physical one. We did conduct this academic game in a very friendly, cordial way, and we have got the pleasure of learning medicine through a game. And for the two winners, you please come here. Yeah, please come. Please come. Yeah. So, winner and runner-up. Don't worry, there is everything. There is something for everybody. Okay. So, yeah. So, you please again. One is yourself.
Myself, Dr. Nilanjan Mal from Rajendra Institute of Medical Sciences, Ranchi. I'm a final year student, MD there.
He is the winner. Runner-up. Yeah, come.
Myself, Dr. Mayank Sodani from Rajendra Institute of Medical Sciences, Ranchi. Also, final year student in MD Medicine.
So, on behalf of the Fever Foundation, I am pleased to inform a prize money of 50,000 rupees, 50, to the winner, and 30,000 rupees for the runner, and others need not be disappointed. All others, remaining 6 persons, will get 10,000 rupees each, which you did not expect. Okay, so all of you smile and stay here for 2 more days, that is today and tomorrow, and learn from this Fever Fefcon 2024. And the organizers, I am a part of the organizing committee, but still there are somebody who is working actively. So in the afternoon, Dr. C.N. Manjunath, the chief guest, he will be inaugurating the Fefcon in the inaugural function, and the winner and the runner please collect the memento or the trophy from him. And regarding the money, I am informed that it will be transferred online. Am I correct, Mr. Praveen? Yeah, it will be transferred online. So, no cash transactions today or tomorrow. Money is online. The winner and runner-up will get the memento from the chief guest, the inaugural function in the afternoon. Yeah. I'm sorry, I did not. Yeah. So I think with this, we complete the medicine program. But before that, my colleague, co-jury, Dr. Panda, he will also speak on this occasion. And I thank all of you, particularly the audience. You have been very friendly and supportive, though very few chocolates were used up. Thank you very much.
Thank you, sir. Actually, the whole process of quiz is so well conducted. I was part of the journal online quiz, and they are also very interesting, very interactive. And the representatives you are seeing here from all over the country, starting from Delhi to Ranchi to Gujarat, Pune, all parts of the country is represented. The message goes very clear for the graduates. When you are studying, to the theme or the core issue, the chapter or the concerned subject. All the infectious diseases that you are covering or the causes of fever you are covering, the key things you have to remember. It's not that very rough or rough picture you will take, but is tested medicine quiz or a fever quiz. So starting from zonal to national, well organized, it seemed that the team of quiz masters, Anupam, Sham, Lakshmi, whole team preparing team, also the hosting team, Dr. Praveen, the whole team were so committed that equal opportunity were given to all, but spontaneous answers came. Give a big hand to participants. We had two winner and runner, but all of them have performed equally. It's just knock and little difference in mark. Don't get disappointed. There for you, and keep it up. Read analytically, participate, tell your friends, and those who have won, definitely they are the best. Those who have lost also are not less. Congratulations to winners. Congratulations to all of you. Thank you, team Fefcon. Thank you, team Lady Harding, who have done it very well. Yeah.
Congratulations to all the participants for doing very well. Those who could not make it to top and second prizes, that is all part of game. Somebody has to excel, and we look forward to having good decisions after you pass out also, and join our fraternity and keep supporting Fever Foundation and keep participating in maybe better ways than your graduate participants had like. Thank you so much.
I request Dr. Manjula to please provide them a certificate that because that certificate will be valuable, because that will be PDF scanned and they will keep it. Yeah. Thank you. So now it is over to pediatrics team. Yeah. Thank you.
Yes.
all the people who, Praveen and all the people, and Krishna Kumar was very useful for us. Congratulate them for this wonderful offering. We also congratulate all the participants because they did a very good job. Were able to answer all the questions mostly. And we also enjoyed as a team of medicine, right? I'm a physician, and as a team of medicine, we enjoyed. And we emphasized on the need for learning, and also we told them that they have to read Nelson and Harrison. So that was the point of interest that we told them. It's not the online thing alone that you do, but you also sit and read your textbooks. So you keep in memory for long what you learn and practice in life. So thank you very much for this thing, and I think Dr. tell the.
Before that, I think our other juries are most knowledgeable.
Beloved friends, it gives me great pleasure and privilege to be here with you to participate as jury in the quiz program for pediatricians. I should congratulate the Fefcon team, Dr. Manjula, Dr. Praveen, and Krishna Kumar and others for organizing this quiz program for the 7th or 8th time for pediatricians. We all enjoyed the program very, very well, and our students also participated very well. They were doing very well, and we have, as Dr. Moses has said, as a professor of pediatrics, I have advised them to read Nelson from first page to last page to have a very good knowledge in theoretical pediatrics and also clinical pediatrics. And I wish that this program will continue for years, and I wish Micro all the best. I wish all the participants a bright future. They should not finish with MD pediatrics. They will continue your studies and to take DM in pediatrics. Thank you.
We would like to congratulate your foundation team for supporting such a good academic activity. Every year they are still doing, and they are doing great to see that our foundation also they conducted with also congratulate participants. Yes, also continue, but they say that one year go to
It was a pleasure conducting the questions. All the participants, the winners have for youngsters, a lot of youngsters here. Messages to convey. All said that read Nelson. Clinical sense. But two message I want to AI. Intelligence. To learn from it. Third is about the genomics. Long way. All your disease times to life rank. With the what alone will make intelligent. Wisdom will come around.
Just I would add to the what sir has said. Medical practice runs through clinical equivalent. It runs on as sir has said, the books will definitely give you an edge. On the contrary, for examination, passing an exam, books are more required nowadays because there are an MCQ type of questions which
not find clinics, but when you come out in the market, actual practice, the clinic.
Uh, Yashri. So it is well fought. Prize